I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on patient transplant blindness. So this is about Mr. Rest, a lovely gentleman that's been sent in to see me. He'd had full transplants done many years earlier, and he's in his mid-60s. When I first saw him, he'd lost one eye from a full transplant, and now I was managing the second. Let's go back to why he had the transplant. Firstly, what is a full transplant? A full transplant is an eye. The whole front of the eye is removed, the cornea, and replaced. And what that does is it opens up the eye, and now the inner contents of the eye are exposed to the world. And believe it or not, once you replace the transplant, yes, you can restore the optics, but you change this section of the eye. You can cause other problems inside the eye. And one of the problems here is filtration of fluid and glaucoma, pressure. So the first time I saw him, I asked him why he lost his right eye. He lost it because he developed an infection and had the eye removed. Artificial eye, completely blind. So I had to deal with his second eye. The transplant was failing, a full transplant. So I put a cell transplant on the back and he got his vision back. Fantastic. We're all very happy. However, he had undiagnosed glaucoma and poorly managed glaucoma in this eye. And over the years, glaucoma surgeons were a little reluctant to step in and get the pressure under control. He came back in to see me recently, urgently referred in to fix his cornea. This time something was different. When Mr. S walked in, normally he walks in, takes a seat, says, "How are you, doc?" This time he had to be led in and feel the seat. And you can tell immediately this gentleman can't see. And when you have a corneal problem, you don't do that. You can still see enough to navigate your way around. So I knew immediately this gentleman was losing vision from his nerve. He sat down and said to me, "I don't know if I'm wasting your time, doc." I said, "Why?" He goes, "I don't think the problem is the cornea." I had a look in and he was correct. The cornea was clear. However, he's going blind. He's going blind because of glaucoma. His pressure was out of control. At 20, too high, because at other times it's probably higher, poorly managed, and slowly over the years, he's lost vision from glaucoma. So transplant blindness, there are many different ways you can go blind with the transplant. This gentleman had two, an infection in one eye and glaucoma in the other. The sad bit is you can't fix the glaucoma once the nerve is damaged. It's too late. You have to be proactive. So if you have a full transplant, you've got to make sure that pressure is under control, and I insist my glaucoma doctors operate and lower the pressure, because without it, the patient will go blind. Full transplantation is a really, really, really wonderful procedure. It works for the right people. But once you have a full transplant, your eye is never the same and you need long-term management. Do not ignore it. It's the reason I do layered transplants. I'm a strong proponent of layered transplants. We don't see this problem with layered transplants. We've eliminated blindness, this type of blindness. But back to full transplants. If you do have one or are in need of one, please make sure the pressure is under control, and that's your responsibility. Make sure it's under control. And if it needs surgery, it needs surgery. You may as well have it, otherwise you're going to lose vision. I hope that all makes sense. Thank you for watching. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastics in Sydney.